Now another question. Most common cause of dissecting hematoma, or other name is aortic dissection. Hematoma, why are they saying hematoma? Because the blood is flowing into, which color will I use? Okay, the blood, okay, red only. The blood is coming here and it is getting inside here. It is looking like sorry, it is looking like hematoma. So it is dissecting hematoma. So the most common cause of dissecting hematoma, what is the answer? Now I know all of you will answer B, but the answer is A. The most common cause is hypertension. Okay, so most common cause is hypertension. Don't forget. Marfan syndrome is also a cause of it. As I've told you, Ehlers-Danlos syndrome. We saw, isn't it? There is aortic aneurysm, aortic. So if there is aortic aneurysm, there is also Ehlers-Danlos syndrome. Then in trauma, okay, and in Turner syndrome. So all these are associated with your aortic dissection. So don't forget hypertension. If you want to remember, first one is Marfan's syndrome. So if you want to remember a short form, it is MET, M-E-T-T or MET. Okay, aortic dissection, don't forget. Aortic dissection is a complicated area of aneurysm. Please note this. Aneurysm is just a dilatation. Dissection is cutting in the blood coming out of it. So these two are two different conditions. The most common cause. Now, why is the dissection happening in hypertension? Understandably, the blood is flowing at a very fast pressure. BP is very high. It can dissect slowly by slowly, it can dissect. We saw why it is happening in Marfan's. What is that? What is the cause? Medial degeneration. Ehlers-Danlos, why? Collagen problem. Trauma can naturally happen. It Turner syndrome, again related to some genetic defects. Okay. So yes, yeah, this is a typical picture you can see here. So yeah, I think I'll use blue. So normally this is the blood flow. What happens is the blood flow. There's another false cavity being created. Okay, which causes the blood to flow into that. Okay, and leading to this particular problem. That is a pseudo-lumen creation. Okay, yeah, this is it. Which one? This one. Okay, this one you can call it. Now, please note there's a condition where you will get the blood here. Okay, where your outer wall is also broken. Your outer layer is also broken. Adventitia is also broken, which is different. We'll come to that. Okay, anything I'm missing out for you? No. Okay, so we said, yeah, popliteal artery is one of the causes of, okay, we'll come to that. Popliteal artery aneurysm is more commonly, it is basically aneurysm. So I should say that we should have discussed a question on aneurysm. Is it missed? Yeah, it is there. So most common cause of aortic aneurysm, we said dissection, which is break, but then initially dilatation should happen. Then only dissection happens. But we said the most common cause of dissection is hypertension, and Marfan syndrome is second most common. Okay, and MET is a Ehlers-Danlos and trauma Turner's. But then if we ask you most common cause of aortic aneurysm, what is the answer? Everyone wants to stick on to Marfan's, and that's why my purpose, when you see this, it's not Marfan's. It is atherosclerosis. You know what it is. Okay, the plaque built up on the vessels. Basically, what happens in atherosclerosis is plaque built up. This can weaken your vessel wall, and it gets dilated. So most common cause of aneurysm is, hope you all understood the difference between aneurysm and dissection. Okay, basically aneurysm is just a bulge. Okay, an enlargement or a bulge, you can call it. Okay, and yes, again, this is all connected. If you ask the causes of aneurysms, the most common cause, as I've told you, is atherosclerosis. Then if you ask me the second most common cause or the more common cause, again, it is Marfan's. Because Aneurysm is leading to dissection only. We saw dissection is very common. But then hypertension is not a very common cause of aneurysm. Though it is there, it's not a very common cause. Again, Ehlers-Danlos is there. Ehlers-Danlos is also there. Okay, and one more additional lesion here, if you want to, you need to remember, it is Loeys, okay, diet syndrome. One of the option, I think, when we discussed on the WhatsApp, it is it. Loeys diet syndrome, Ehlers-Danlos and Marfan's. The other one was MET, so that was more into trauma and Turner's. The most common was hypertension for dissection. Now coming to aneurysm, the most common is atherosclerosis. Again, we have ME, but then slightly different here. You can call it as MEL if you want to. Okay, Loeys diet syndrome. Basically, we saw that Marfan's is a problem with elastin. Ehlers-Danlos is a problem with collagen. This is a problem of elastin and collagen. Okay, because it is affecting a gene, or I would say a receptor, TGF beta receptor. Okay, TGF beta receptor. Now, TGF beta receptor is a signaling molecule for the synthesis of elastin and collagen. So, if TGF beta is affected, you will get problems with the elastin and collagen. Here, basically, it's all about collagen gene affected. Marfan's, it is only the fibrillin. So, it's elastin related. Here, TGF beta, the more receptor is affected. You know that anything to happen in the body, there should be a receptor getting stimulated. So, this receptor is affected. You don't get your collagen. You don't get your elastin. So, you get all the problems associated. I'm not going into details because no questions has been asked. So, we said, don't forget this. Most common cause of dissection is what? Hypertension. Second is Marfan's. Most common cause of aneurysm is atherosclerosis, Marfan's. Okay, at least two you remember, it is enough. Yeah, this is your okay, aorta, abdominal aortic aneurysm is what you call it. Okay, okay. I'm not going into too much of details. This is your okay. This is another cause. MI is one of the causes. Okay, myocardial infarction is another cause where you get so this aneurysm of your ventricular walls. Okay, should I go into details of this? I'll give you some terms, something to remember. Okay, so about aneurysm, the most common peripheral vessel. Okay, just write it down there. Some extra points about aneurysms. Most common aneurysms. So most common peripheral vessel to undergo aneurysm is here, as I've told you, it's a popliteal artery. Basically, popliteal artery is something which is related to your knee. Okay, your knee. This is your popliteal artery, which is associated with your knee. Okay, so that's one thing. Now, yeah, I'll put it here because this is where, okay, this is the most common peripheral. Okay, then if you ask visceral, the most common visceral artery which is undergoing the aneurysm, this is splenic artery. Okay, the spleen, the artery which supplies the spleen. The most common central vessel which is undergoing aneurysm is something which you will learn in surgery also. Okay, central vessel is abdominal aorta. Abdominal aorta. So basically, what is abdominal aorta? You have got your ascending aorta going up. You have got your descending aorta. This descending aorta further comes down and gives rise to abdominal aorta. So basically, I should have been a little more correct here. You have got your descending aorta here. I'm sorry. Descending aorta here. Then you have got your thoracic, then abdominal. Okay, so this is the most common central vessel, just to know. Okay, people clearly, why I'm saying this is, they will confuse you. Most common central vessel, abdominal aorta, thoracic aorta, ascending aorta, descending aorta, basically it's abdominal aorta. And this is also the most common of any vessel. Okay, we said peripheral is popliteal. Okay, popliteal. Visceral is splenic, central is abdominal, but the most common in any case it is abdominal, just an extra point to note. Okay. Yeah. This is another thing which you should be aware about. So just to teach you a little bit of basics here, but did I miss any question? No. Okay. On aneurysm only. So basically, this is what I was talking to you. Your three layers, adventitia outside, media in the middle, intima. So what you have got true aneurysm. There's a possibility. There's a false aneurysm, and there is also dissection. Okay, true aneurysm can be saccular, can be fusiform. Very simple to understand. It's in the form of a sac here. This is both the sides are enlarged, fusiform. Okay, so hope if you understand the major differences between this, I'll tell you what is the technical difference or the structural difference. Basically, aneurysm is just a bulge. So you get a bulge on one side or bulge on two sides, and there is no break in the wall, except we'll see it in the false aneurysm a little bit. Okay, no walls are affected, walls are intact. Okay, but then as I've told you, in your dissection, your intima gets problematic. The blood leak into your media, but it is very clear here that your externa or adventitia is intact. Okay, now what happens in false aneurysm? The blood leaks out outside the vessel completely. Even your externa is also, or adventitia is also broken. The blood comes out and is in the extravascular connective tissue as a bulge. Okay, so it's a kind of hematoma again. False aneurysm. Okay, false aneurysm. So that's the difference between true aneurysm, which is again it's just a bulge, the blood is inside. Dissection, yeah, still you have the outermost layer intact. False aneurysm, basically the blood is in the extravascular connective tissue. We feel it like it's an aneurysm, but actually the blood has leaked out. Okay, so just an extra thing to know. Okay, because otherwise, why so much pages? Am I missing on anything? So this I need. That's why I told you yesterday. I need this reference. I can teach you, but then if I miss a lot of points, it is you who is going to miss out. Nothing. They just left a lot of pages. Yeah. So we said about dissection, aneurysm. So calcification. This is the next question. What's the question? We saw all those. So calcification of the aortic valve is seen. That's the answer. You're reaching 1 hour mark, but then we'll quickly. It is not Ehlers-Danlos. You are expected that after Marfan's, we'll jump on to Ehlers-Danlos now, but I'm going on to syphilis. Okay, very good, Parvati. Very good. C is the answer. Okay, syphilis. Basically, calcification of the aortic valves are seen in two infections. I want you to tell me, when we said about syphilis very recently, what was that in syphilis we saw? Along with Ehlers-Danlos and Marfan's. What was that? Retinal detachment? No, Baba, no. No. Aortic aneurysm in the beginning. Aortic aneurysm, very good, Banjo. So aortic aneurysm, please note, is also seen in syphilis, tertiary stage of syphilis. Aortitis, you'll learn this. Aortitis and aortic aneurysm. I think there's also short form to learn the cardiac lesions there. But just to connect again. So aortic aneurysm, we saw it is there in MEL. No? MEL is the one. Along with that, just write S also. MELS. Okay. Or smell would have been the better short form, I guess. Yeah, wonderful. Smell. Right there. Smell. So S is for syphilis. But don't forget, the most common is atherosclerosis. The second is Marfan's, not syphilis. But now coming to calcifications, that is seen in two lesions. Calcification of the aortic valve. Now, you might be saying that this is all something to memorize. But then whenever you see most common, it can asked as a clinical question. For example, they will give you some features of syphilis. And what is one of the features? Shankar. But then something will confuse you. What is that? Calcification of the aortic valve. They'll say that it's a sex worker or something like that because it's a sexually transmitted disease. So basically, the most common is always important. Okay, the terms most common. They can ask you question. How do you learn it? Revision. Okay, so calcification of aortic valve is seen in syphilis. One more condition, which is again an infection. Okay, let me take that page. Yeah, it is basically rheumatic fever, where we saw what type of murmur connection. What type of murmur in rheumatic fever? So two conditions where you see calcification of aortic valve is one is syphilis and second is rheumatic fever, which is a streptococcal infection. Pansystolic, exactly, Manju, very good. You people are listening. So basically, why? Because it's an infection. No? Both of them are infections. So basically, there is inflammation and scarring. Scarring leads to calcifications. Okay, so just remember, calcification is more common when there is aortic valve is infected. Wonderful question. Okay, it's a medical question also. 26-year-old, don't look at the keyword, just read. Okay, something comes to your mind. Presence because of trouble with her vision.